Hey guys, it's Dan with Pain for You. Today's topic is going to be, yes, it hurts, but it's not harmful. So let's take a couple of nice deep breaths and then we'll get into it. Breathe in the confidence. Breathe out the fear. Breathe in the peace. Breathe out the noise. Breathe in the safety. Notice that. Breathe out the fear. So, pain hurts. Yes, it hurts, but it is not harmful. I will tell you, 13 years of pain. Chronic pain had me twisted up. You've probably seen those pictures. If I forget to post them here, remind me and I'll stick it in a comment on this post, on this video. But even though I got all twisted up and jacked up, that was the result of the pain. Although it wasn't harmful. I just had muscle imbalances created by me compensating for the pain for well over a decade. So pain is painful. It hurts. It sucks. It really sucks. But it's not harmful. And as bad as your pain is, whether you can't even walk, whether you can't get out of bed, whether you can't do whatever, I will tell you, it is not harming or leaving permanent damage in your body. The mind is using this pain in a maladapted way to try to keep us safe, to keep us from doing things that it believes are dangerous, like movement, like social situations, like feeling emotions, which we've been taught are bad. But the pain's created in the brain, which means there's nothing happening in the body other than, the sensations, those messages. So the body's not being harmed by this. Now I can hear people with reflux saying, oh, but Barrett's syndrome, I'm messing up my esophagus with the reflux and the stomach acid. I will tell you, I've done the research on it, not a ton, but I've done the research, and a fraction of a percent of those people with chronic reflux get Barrett's syndrome. And then a fraction of those with Barrett's syndrome ever get throat cancer. It is such a small percentage of a small percentage that worrying about that is just going to keep you stuck. Because if you believe that you are in danger, like I've said 100 times, your brain's not going to turn it off. If you believe you're going to get cancer and die, your brain's going to go, oh my God, don't eat that food. You might get some reflux. It might kill you, right? And so, while this stuff is painful, and while it hurts, it's not harmful, right? And that reflux is the only example I can have that there's even a discussion. Everything else, back pain, I've had such crazy back pain over those 13 years, and I know how bad it is. I was stuck on the floor for 14 hours, but nothing was harmful. And when I finally learned to get all this stuff dialed in right and finally get rid of the pain, there was no lasting damage. As a matter of fact, I tell a lot of my coaching clients, I feel better now at 55 than I did in my 30s, 20 years ago, 23 years ago. And so, while it is painful, while it really, really hurts, it's not harmful. So if you're concerned that you're going to end up with permanent nerve damage or permanent anything, permanent, it's not harmful. And let me just say this also. For anybody who has had past medical treatments, whether it be an injection or a surgery or a fusion even, many people say, oh, but I made that mistake. I had that treatment done. Now I'm really screwed because they messed me up permanently. I will just remind you, the body heals. The body knows how to heal. The body is very adaptive in its ability to really go through life without pain. My ex-father-in-law is 80-something years old, had polio as a kid. He walks with a limp. He's all jacked up and twisted and can barely walk. He needs a cane or he's going to tip over. He's so jacked up. He doesn't hurt. He doesn't. He's got some weakness and he struggles. But he doesn't hurt. He hasn't hurt most of his life. He was able to work through into his 70s. Now that he's retired, he still doesn't hurt. Needs a lift to go up the stairs, right? One of those little elevators, a chair that'll like scoot you up the edge of the stairs. He needs that because he doesn't have the strength, but he doesn't hurt. So structure doesn't cause pain. Posture doesn't cause pain. Injuries heal. They don't cause pain 20 years later. I'm not a believer in that. I believe that pain that sticks around for 20 years is neuroplastic pain. It's learned pain through fear, focus, and anxiety about the original incident, and the fear that it won't ever heal properly will literally teach the brain to keep firing those signals. So, look, gang, I know this stuff hurts. I know it hurts bad, but it's not harmful. And so please, if you're having any dialogue in your head about how this stuff is harmful and it's hurting you, meaning it's injuring you or it's leaving damage, it's not. It's not. Sarno talked about that in his early books. It does not leave any damage whatsoever. So while it hurts, it sucks. And if you can learn to teach your brain that you're okay, we can make this pain go away. And in my case, I've kept it away for over 10 years with 2 minor incidences where it came back for about a week to 10 days. I just followed the things I'm teaching you, and it went away. I had to teach my brain that, hey, this is no different. It's all still TMS. Did a little bit of connecting with my emotional world. And by not giving a crap about it and shifting my focus back to my life, not letting it stop me from doing anything that I wanted or needed to do, I got better. You can too. So, while it hurts, sometimes like a real son of a bee, it's not harmful. So please don't convince yourself it's harmful. Anyway, comment below if you have previously thought TMS is going to leave damage. It's not. But let me know. I want to see how many of you guys and gals have come to that conclusion. And let me know what you think. So, we'll talk to you soon. Love you guys and gals.